Go ahead, go. It's not 2 o'clock yet. It's different than my phone. Mine says 1:59. All right, you're good. All right, good afternoon, everybody. My name is Deshane Barnett. I'm the Director and Health Officer for Missoula City County Health Department, and I am very honored and excited to introduce Holli Hargrove is going to be doing today's presentation, which is the role of animal services in public health. And Holli is the Missoula Animal Services Manager. Missoula Animal Services is under the Health Department, formerly Missoula Animal Control. So you might be used to hearing that, but we're trying to move toward a strengths-based approach. So it's Missoula Animal Services. So she's going to be talking about the role of animal services in public health. And if you're online, please also join us next week when Alexandria Albers presents Refining Population Level Measures of Early Childhood Vaccination Coverage, an informational seminar. And so that will be next week. But today, I'm very excited to bring up Holli.
Well, thank you. As Deshane mentioned, my name is Holli Hargrove. I'm the manager of animal control. I have been working in animal shelters for at least the past 10 years, either in a government capacity, a nonprofit capacity, a nonprofit with a government contract capacity. So there are all these different types of shelters. So I'm going to go over a little bit of what we do in the background and some of the terminology to begin with, because I think it can be very confusing for people, and it's not a very standardized industry. It can change from state to state and from county to county as far as how their facilities are organized. So we'll go ahead and get started. If you don't know where we're located, we are located out on Butler Creek Road. If you go past the airport on West Broadway, get to the Smoke Jumper Center, you're going to turn right, go over the railroad tracks past elementary school, and animal services is going to be there on your right. So I encourage everybody, if they haven't been out to visit, to please come visit. I will be happy to give you a personal tour. Our mission, this is the outside of our building and our sign. Our mission, of course, we're dedicated to the protection and care of all domestic animals and safety of the public. And we do this through enforcement, education, and sheltering. Our goal is to truly care for Missoula's lost, injured, and abused animals. So we never know from day to day what's going to walk through the door. We might get no animals for 2 or 3 days, and then we might get slammed with 6 dogs and 4 cats and 1 day, and then 1 cat the next day. You never know if it's going to be guinea pigs, birds, mice, rats, ferrets, dogs, cats, occasional chicken. So we pretty much see it all. So for 2022, I wanted to look up some of the numbers as far as what we do there at our facility. We took in 19,673 inbound calls to our main number last year. Of those calls, we opened up 2,254 cases for our animal control officers to run. We took in 1,355 intakes for animals. We staffed the building from 7:30 to 6 p.m. 7 days a week. Even though we may not be open to have public hours, someone is there from 7:30 a.m. to 6 p.m. 7 days a week. So if we're not open to the public, then we're cleaning and we're feeding and we're medicating, we're vaccinating, and we're doing dog health checks and dog meets for behavior and things like that when we're not open to the public. And we do all of that with 12 full-time staff. So that staff includes myself. We have 5 animal control officer positions. Right now we only have 4 staff and 5 animal shelter attendants. So those animal shelter attendants, those 5 over those 7 days, are the ones answering the phones, doing the intakes, the outcomes, all the customer service, the animal handling. We do have a licensing specialist, as well as they are dispatching the call. So our officers dispatch in the morning, and then once we open to the public, our animal shelter attendants take over dispatching. I would like to mention that I did a few numbers as well, and here in Missoula, we actually do have a really great return to owner rate for both dogs and cats compared to the national average. Nationally, around mid 25% range of dogs are returned to owners, and it's usually less than 5% of cats are returned to owners when they enter the shelter. However, in Missoula, if you back out all of the owner surrender numbers and strictly look at your stray numbers, our dog RTA rates last year was 71%, and we returned 14% of our cats to their owners. So we actually do pretty well in Missoula as far as those return to owner rates. So we think that's really great. So what's in a name? Because this is where people get so confused about the industry. And I don't know how many people are familiar, but you hear government or municipal operated shelters, you hear humane societies, SPCAs, private, public. So I'm just going to kind of break down those a little bit. Our municipal government shelter, which is what we are, these are your county run facilities. They are operated via tax dollars. That's how we get most of our funding. We are required typically by law to take in all animals. So it doesn't matter how old they are, what their behavior is, what their medical condition is, we take them. Many government facilities also expand their operations to take in owner surrenders, and we do as well. So if somebody in the community can no longer care for their animals, then we will take in an owner their own animals to us. We don't take in out-of-county animals. That becomes kind of a problem here in Montana, because whereas a lot of states have animal control agencies in every single county in their state, or many counties or humane societies, Montana is one that every county doesn't have an animal control agency or even a humane society. There are some areas, it's a really big state, there are some areas that a humane society might help assist animals from 4 or 5 surrounding counties. So here in Missoula, I believe, don't quote me on this, but I want to say there's only around 4 or 5 animal control agencies for the entire state of Montana. They can be under all different types. Some are, we'll get into this when we talk about public health, but for the majority of the ones here, either a humane society is helping out, or maybe a sheriff's department has a couple of officers assigned, and then they take in the animals, and a humane society actually does the housing for them. So here we're unique that we have animal control and animal shelter all under one roof, which we like to call animal services. So you hear about the private facilities, and these are your humane societies, your SPCAs. A lot of people think they're affiliated with the HSUS, or the Humane Society of the United States, or the ASPCA, and they're not. They're completely separate organizations from those big national organizations. They're private. They are typically funded by tax dollars. They typically have an executive director and have a board of directors that govern that executive director. They're typically 501c3s, or nonprofits, what people think of as a nonprofit. And then some of those shelters also have contracts. So if they're in an area that doesn't have an animal control agency, they may have a contract with a city or a county to do their animal control services for them, or to take in animals if they have police assigned to take them in. The other type of types of facilities that people sometimes see are what are called rescues or sanctuaries. And so typically rescues or sanctuaries can either be a brick and mortar building, or they may be foster based. They tend to have sometimes one type of animal that they take in. They may look at, well, I'm going to do a rescue for only senior animals or only deaf animals, or they may have a specific breed that they like to take in or have a sanctuary for. Those tend to also be nonprofit, 501c3 type of organizations. So those are your various type of shelters. And then you hear these terms called open admission, are open intake versus limited admission or limited intake. And this is where I think people also get confused. Open intake means the shelter's taken any animal, as I mentioned, that's typically how government shelters are, regardless of their temperament. So regardless of the behavior, we're not going to turn them away, regardless of how old they are, how sick they are, how injured they are, we'll take them. If it says open admissions, that's typically what that means. Limited admissions, on the other hand, these facilities tend to take in animals that they can sort of maximize their skills or their space. So if you have a private facility that's a limited intake, they may say, well, we only have 2 open cages, so we can take in 2, but then that's it. We're not going to take in any more. Or we don't feel that this animal from a behavior standpoint or temperament standpoint fits into our adoption program, so we're not going to take that one in. So that's more of what your limited admissions means. They don't have to worry necessarily about overcrowding and if they're going to get 20 in that day, because they can say, wait, we're limited, we don't have to take it. I like to encourage people, though, that that's not always a bad thing for those organizations, because if you think about it from a number standpoint, we want to save as many lives as possible. So if they have one dog that they feel might be really difficult to adopt, and that dog is taking up a cage in their facility, if it's there 6 months, 20 other dogs may have been able to use that cage or that kennel space and be adopted. So for them, yes, it is about numbers and what they can maximize, but if they're able to say 20 lives versus that one, it's, you know, you have to think about the math too, because we are all in the business of wanting to save as many lives as possible. We all help each other out, so that's the great thing about this industry. The other terms that people hear that I don't like to use, because I think it pits organizations against each other, is kill versus no kill. And we all hear that. Well, I want to go to a kill facility. I don't want to take them to a kill facility. Well, I don't like to use those terms because honestly, most people assume that no kill means nothing is euthanized. That's not typically the case. The definition of no kill is really defined by saying that no healthy adoptable animal is going to be euthanized. So basically, if you're not euthanizing for time and space, and you're making sure that every healthy, treatable animal finds a home, and your numbers, your save rate is above 90%, you can consider yourself no kill. That's sort of the definition. Honestly, if somebody is saying that we are no kill and they're not euthanizing anything, you may have a bigger situation on your hands, because you may have a hoarding situation on your hands, and they may just have animals piled in crates, you know, for all you know. So really, you don't want to you want to kind of look beyond the labels and really look at the facility itself. Animal services here in Missoula, we can be considered, we don't put a limit on time and space. And I did our numbers, and last year, our save rate for dogs was 97%, and on cats, it was 95.5%. So technically we fall into that no kill status, but I don't like to use those terms because you never know. We could get 50 dogs in tomorrow. If we only have 24 kennels, hopefully we would look to the community to help us out and try to find places for them. But I never want to say that it wouldn't happen if we were put in that situation. But we haven't been in a really long time. The community is really great. So I don't see that happening, but you just hate to represent something that's really could possibly be out of your control. So public health, right? So that's the reason I'm here today to talk to everyone, is about public health and how animal services and public health align. So what most people would think of when they think of public health is improving and protecting the health of people in the communities. We've all heard of the benefits of living with a pet. There's emotional benefits, mental benefits, physical benefits. You know, pets, they say, reduce stress, they give people a purpose, they connect people with others, they get people get out, it increases their physical activity. So all those things definitely are public health related. However, what's kind of odd about the industry is it's not always beneficial to the well-being of the shelter personnel, believe it or not. Shelter personnel that work in this industry have a very high level of compassion fatigue and burnout in their job. So it's a little, interesting that how the benefits, but when you work in that, it really can be the exact opposite. So it is nice that we get to pet kittens and puppies, and I should have brought a dog today that can, that can reduce everyone's stress level. But I didn't, but next time I know better, I can bring a dog on campus. So with that being said, how do these, it was brought to my attention that there are these 10 essential of public health. And so I'm not going to go over all 10. However, what I will do is kind of group them into the 3 core functions of assessment, policy development, and assurance, and kind of talk a little bit about how those 3 things line up with how we operate animal services and serve the community. So the first one is assessment. So assessment, we want to assess, monitor the population health, in addition to addressing and investigating health hazards in the community. So what we do as far as the animals in our care, immediately on intake, we vaccinate everybody. Shelter medicine is a completely different ballgame than, say, your public or your private veterinarians, because we are dealing with herd health, not private practice. So we vaccinate everybody on intake. We deworm everyone on intake. We try to look for signs that something may not be right with that animal, so we can isolate it from the rest of the population if we need to. So we're looking for anything out of the ordinary. The other thing that we do as far as monitoring population health in the community is the ordinance requires that all dogs, not just in the city of Missoula, but also in the county, so that reside within the county limits of Missoula, have a license. And what that does is ensure that they have the current rabies vaccine. It also helps support us taking care of all the animals that are in our shelter, that are in our adoption program. It assists with the animal control officers going out and doing investigations and responding to calls on cruelty and welfare checks and animal hoarding and people not having their dog on leash or not picking up their poo. And it's also means you're in compliance with the law. So we've got this little video that I'm just going to play about licensing your dog and how it's cool, just for fun. If I can get it to play. Hopefully, if you have a dog or know anybody, encourage them to get their dog's license, because we would love to have more people compliant. So in addition to the things we sort of do at the shelter on a daily basis, our animal control officers do respond to animal cruelty cases, which I think have a lot of correlation with public health. The quality of life, oftentimes for an animal on a call like that, is a huge red flag for the quality of life of the people in that household. Oftentimes there's a big correlation there. As far as animal hoarding, these also have public health implications. These are complex cases. We just can't go out and do them on our own. We have to get together a task force and a team to go in to assist somebody in these situations, but they do have the potential to have severe respiratory complications with staff that are going into these homes if they're not wearing protective equipment. And they've also done studies that have shown that the air quality in some of these houses is so bad that air quality alerts will be put out. And the surfaces inside these homes pretty much contain bacteria on all surfaces, all people surfaces, not just animal related surfaces. So huge health hazard in when these types of calls when we get them. We were out just last week. Wouldn't say it was full-blown hoarding, but 33 cats were pulled out of the home in a barn, and the conditions were not that great. So we see a lot of that. And then what most people think of when they think of public health and animal shelters are the zoonotic diseases. I'm not a veterinarian, so I won't go into all of the specifics of that, but you have your internal and external parasites, which is why we deworm. We're obsessive hand washers at the shelter. You have your fungal type diseases such as ringworm that can be passed from humans to animals or from animals to humans. You have your bacterial diseases, and then you have your viral diseases, which are less common, but there's a really big viral disease out there that everybody thinks of when they think of animal control. Any guesses? And it's deadly. Rabies. That's the one big one. So that's the one that our roots in animal control and public health are really stem from rabies control. Years ago, when it was really bad, how did they decide to come up with a solution? We've got animal control officers. We're going to go out in the communities. We're going to pick up all the stray dogs. We're going to start vaccinating everything. And that's really where the roots of animal control come into play. Still, we're fortunate in this country. It's deadly. It's not as common, but in other countries, people die from it. I mean, thousands and thousands and thousands of people die from it every single year. There are rabid dogs just in the streets. They don't have any way of having access to vaccines. Dogs are not vaccinated. People are bitten by their own dog and get rabies. So we're fortunate here. It is a scary virus because, incubation can be from 3 weeks to 3 months, and it is fatal. The post exposure prophylaxis is extremely expensive. So we don't want people to just run out and immediately say, I was bit by a dog, I need the vaccine. So we do work with the infectious disease nurses at the health department. I'm going to play a video that was put together by some students that they sent out to all medical providers, because I don't know if everybody's aware, but medical providers are supposed to be reporting bites to animal control. We're kind of that first line of defense. And I've got a few numbers that I'll go over, but this was what was sent to everybody trying to get them to, oh no, what have I done? Trying to get them more compliant with reporting to us, and for people not to panic when a bite does happen, because I think that's what people do, they panic.
Hi, welcome to the rabies post-exposure prophylaxis guidelines from Missoula City County Health Department. My name is Ted Grosbauer, a nursing student with Montana State University. And the slides and graphics were provided by Megan Schwarzkopf, another student at Montana State. So under the administrative rules of Montana, rabies exposures are reportable conditions. So an exposure could be anything from a bite to saliva exposure to a bat exposure. So when somebody comes into the emergency department, we want you to remember that a rabies exposure is urgent but not emergent. As you can see from the figures on the right-hand side, the top one just shows how the virus enters the body and its route towards the brain. And the lower figure shows the median incubation time in the United States is 35 days. So you've got some time. First things first, let's call animal control at 406-541-7387. Be prepared to leave a message for these guys. They'll most likely give the victim a call back the next business day. And they're going to get more information on the bite incident. They're going to help locate the animal, and then they can also put the animal in and release them from quarantine. As previously mentioned, it's a legal requirement to report a rabies exposure. So we want you to get in touch with the county health department at 406-258-4812. They're going to be able to give you treatment recommendations, and they'll also track this case. If you can't get a hold of them, go ahead and call 911 and ask for the infectious disease on-call nurse, and they can answer your questions as well. So we're going to talk about rabies immunoglobulin. The main thing we want to point out here is that you do not need to administer this immediately, nor do we want you to administer it immediately. First things first, we want you to contact the health department infectious disease specialist and let them know what the situation is and get their recommendation. Now, so for domestic animals, by that we mean dogs, cats, and ferrets. It's totally appropriate to quarantine these animals. We do not want you to euthanize them right away. If they're going to develop rabies and show signs and symptoms, it's going to be within the 10 days. And as long as they're alive and healthy at the end of the 10 days, that's their time when they're shedding the virus. So if they're alive and healthy at the end of that, there's no chance that they could have transmitted the virus to an individual. So animal control will work with the victim and their pet to find a quarantine solution that's appropriate for their situation. They do prefer home quarantine if it's possible, although it may not be applicable. But once again, we just ask that you work with animal control to figure that out. For bat exposures, that meaning direct contact, even if there's no bite. So even sleeping in a room and there's a bat found in the morning, that's still considered a bat exposure. So if you can capture it, we want you to send it off to Missoula Vet, and they'll be able to test this animal for rabies. If it cannot be tested, as in you can't find the animal, or maybe it brushed you and then it flew off, then it's appropriate to administer ring. So for any other wild animal exposure, that could be a grizzly bear, be a fox, any other kind of animal that they suspect is infected with rabies, you're going to go ahead and contact the Missoula City County Health Department again. You're going to consult the infectious disease specialist nurse. They are available at 406-258-4812. And just to reiterate that rabies is urgent but not emergent, and it is okay to wait 10 days before administering rabies post-exposure prophylaxis. And finally, for previously vaccinated individuals, they're not going to receive RIG. We really want you to consult the CDC's booster dose recommendations, and those can be administered by the Missoula City County Health Department outpatient clinic. Thanks for your time. Please don't hesitate to reach out with any questions.
So here in our area, probably bats would be the most common carriers, and then you would have skunks would probably be the next. Then a lot of times raccoons, but different parts of the country have different animals that are more likely to carry the virus. Hey, I just bit you because I'm crazy, so call the doctor. It's true. People get on the internet and we tell them like, hey, you know, we have the animal, it's being quarantined, no need to worry, but they can get on the animal and or get on the internet and have themselves convinced overnight that they have rabies. So I had a bat, a group that had to deal with bat infestation once tell me, he said, if you ever get the bat tested, don't ever let the bat go, don't ever do, you know, or dispose of the bat, test the bat, because people will convince themselves that they have rabies every single time the minute they start searching on the internet. So it is true. We don't want people to immediately run out. I've had situations at shelters where somebody knew that the dog was their next door neighbors, went to the hospital, said I was bit by a stray dog. I don't know where the dog lives. And they immediately started the post-exposure vaccines, and they don't need to do that because there's so many situations. It's so expensive. They don't need to go through that. If we have the animal, we can quarantine them for the 10 days. As long as they're not showing any signs of illness, or if they don't pass away in those 10 days, then the chances of them, if they had rabies, of shedding that virus at that time, we're not worried about it. If an animal does get euthanized within 10 days or passes away within 10 days, and we have had this happen sometimes, where an animal was sick and they may have been taking it to the vet to be euthanized and then it bit somebody in the process, those animals, regardless, even if you're like 100% sure that your animal doesn't have rabies, it was maybe a cat that had always lived inside, it always had a rabies vaccine, we still have to send them off for testing if it's within that 10 days, unfortunately. I did a few numbers. So last year in 2022, there were 142 bites reported to us. I'm sure there were far more bites, but there was only 142 reported. 84 of those received medical treatment. And out of those 84 that received medical treatment, we only had 25 reported by medical providers. So we still need to try to do more to pick up those rates of the medical providers reporting those bites to us. So when we do get a call, I won't go over both of these because they're very involved and we would be here for a while, but we have two different types of exposure trees. So one is if a human is exposed to an animal that is a vector for rabies, and then one is if a domestic animal is exposed. So if a human is exposed, if it's a dog, cat, that's kind of where we come in. We're going to go out, we're going to ask the victim questions, we're going to get a hold of the owner of the animal, and we're going to find out if that dog has had a rabies shot, or if it's never had a rabies shot, or if it's just an expired rabies, and then we're going to put that animal into quarantine. We report all of these to the health department as well, and then we work with their infectious disease nurses, and those infectious disease nurses work with the victims to determine, based on if we can find the animal or not, if the post-exposure prophylaxis is necessary in those situations. When it's wild animals, it's a little more tricky because sometimes if it's a bat, for example, in the home, you can test the bat. I mean, if it was a skunk ran by and bit you, and then you can't really go out and trap that skunk, it's a whole other sort of set of circumstances that you have to look into if you can't get the animal. And we had a call, gosh, it was a few weeks ago, that something with their exposure with a raccoon to someone else's cat, and they were like, "Well, come trap the raccoon," but there's no guarantee that we could trap that exact raccoon. You know, there are all kinds of raccoons out there. The chances of it being us being for sure it's that raccoon would be pretty slim. So unless we just trap it and it's in the home, if somebody does have a rabies vector in their home, in their living quarters, we do go out and trap those. With all bats, we test because you could easily be bitten by a bat and never feel it, never know about it. And I've had that happen to me. I'm that person that woke up one morning and a bat was I was remodeling a bathroom, had a roll of toilet tissue in a window, and I went to move it out of the window, stuck my hand in the center roll, and there was a bat in it. I screamed. It was squishy. I knew it wasn't supposed to be there. Fell to the ground. It started making sounds. So yes, the bat had to be tested. It was negative, but about 2 weeks later, a positive bat was found just in the very next town. So it does happen. I did not expect it. I wasn't so much worried about rabies as that I convinced myself I had a bat infestation in my head. So I was more freaked out about that. When it comes to domestic animal exposure, if someone calls us, "Hey, my cat killed this bat, my cat was attacked by this raccoon, my dog was attacked by this by a raccoon or a skunk," so then it's kind of the same thing. We're going to find out, hey, did your animal have a current rabies shot? Chances of us having access to that wild animal is slim unless the pet owner was able to kill it in the process of it harming their animal. If that's the case, then we'll send it off for testing. If it isn't, then we have to follow, okay, well, if they had a rabies vaccine, we're going to send them out to get a booster. If they didn't, or it was expired, we're still going to send them out for a booster. And if all else fails, they don't have a rabies vaccine, we can't get the animal, we're either going to quarantine that animal. It used to be 6 months, now it's 4 months. Or if an animal comes into the shelter, say a cat or dog with an unknown bite, and it's clear that a veterinarian says, hey, this is a bite, it's unknown origin, we don't know the vaccine status of that animal, what this exposure tree says that it's recommended is immediate euthanasia for that animal. Or you can quarantine it it's not ideal to quarantine an animal for that long in a shelter. We don't get too many of those. If ever, typically it's a cat that might have a unknown bite. And they're actually usually cats that we really can't handle. They're more of your community working cats that come in with an injury like that. But that is what the assessment tree asks us to do. And for anything that's a domestic animal exposure, instead of turning those over to the health department, we're actually going to report those to the Department of Livestock. And then the state shelter medicine group will follow through with those quarantine periods. So then as far as policy development goes, we're going to talk a little bit about how we, about education and community support partnership, our ordinances, our citations, all these things that people hear about in animal control. So education is important. Hopefully one day we can get out and do more of that, because I see it always, if you can get it in the minds of a child when they're young, they're the ones going home and saying, oh no, mom, we need to pick up that poo, or that dog needs to be on a leash, or no, this is how you approach a strange dog. Because I see even adults in the community all the time with their dog is super nervous, it's super fearful, and they're like, come on, he's friendly. And I'm seeing all these signals and I'm like, no, don't approach that dog. That dog might bite just from its body language. I just don't think people are as familiar with dog and cat body language, especially if you don't work in a shelter environment. So as much education as we can do, we're always educating people on the phones when they call in about barking dogs or leash laws and things such as that, what we can and can't do with welfare checks. You also have support. So as far as animal services goes, there are many ways that we can support the community. So people know of individuals out there that need help. We do have an owner surrender program if they can no longer help their animal. If someone is taken to the hospital or arrested and they have their animal with them, we have a safe keep program. So first responders will call us, we'll go out, we'll take that dog or cat, and oftentimes it's dogs and cats. We even had some safe keep fish once. That was interesting. It was a huge tank. We actually couldn't bring the fish to us, so we had permission to go in and we would feed the fish each day until we were able to work out an arrangement. But we will do that. We'll hold them for 3 days for no charge. And then on the fourth day, the regular stray hold, or what we consider a stray hold, kicks in. So we have to we hold all animals for that 96 hours. And then at the end of the 7 business days, we do make them available for adoption. If somebody can't afford food, if we have food, we will give food out, leashes, collars, anything like that we have that can help somebody if they come by. If we can't help them, then we will kind of direct them to other resources in the community that we think might be able to help them. Partnerships. Okay, so we work with so many people in the community. We have veterinarians that help us do all of our spay and neuters, check on the animals. And we have animals that come in that have injuries or have been hit by a car. We work with the sheriff's department and the police department and Fish and Wildlife. So oftentimes they'll call us to go out and assist with something if there's animals involved, or we'll call them to go assist us on calls if we would like for their assistance. So we're doing that on a regular basis. Community partnerships. When we need help, we're really full, we'll call the Humane Society or Animals, and they can help us move animals. So we're not put in that position where all of our cages are full. Oh my gosh, if we get dogs in today, we need your help. So we do have a really great working relationship with these guys, as well as other shelters in the state of Montana. We can call them up. Some of the private ones that don't do intakes, that aren't open admission, will say, hey, we just adopted all of our cats out. Do you have any cats? Yes, come take as many cats as you would like. Same thing with dogs. If they're low on dogs, we have cages full of dogs. We'll transport our dogs to them, and they'll help assist us with finding them homes. And then it opens up more space for us to bring in animals in need in our community. And then I didn't put this on here, but you, the public, they're a huge partnership. The community comes out, they foster dogs for us. We put just a message out last week about a mama dog that had 6 puppies that we needed to put in foster. They were only about 4 weeks old, fostering kittens. coming to the shelter to volunteer to walk dogs, socialize cats, as well as donations. So we look at the community as just as much a partnership. As far as our ordinances go, our officers are not sworn officers. So we are only able to enforce what is written in our codes. So we have a animal section for the county. We have a code for animals that's related to when you're in the city limits. So that's the first thing we're going to ask when somebody calls, we ask for an address, because we've got to know, is it in the city or is it in the county? So we know which ordinance to look to see what we can enforce. And then there's also a health code that's the city county health code. Part of our responsibilities in that is the bear buffer zone and the trash ordinance, as far as people living in those zones, trying to prevent bears from getting into trash cans because of the fed, what is it, a fed bear is a dead bear? Yeah, so we want to save the bears too. We issue permits. These are typically situations where there's multiple animals on a property, and we want to be able to go in and do inspections if somebody complains. You know, we don't, in the city limits, you don't expect somebody to have 20 dogs in their house, right? So if you have more than 2 dogs, you're supposed to have a multiple pet permit in the city of Missoula. In the county, there are kennel permits. If it's 6 to 20, it's one level of a permit. If you have over 20, it's another level, but it just allows us to go in and make sure that the conditions are what they should be for both the person as well as the animal. Boarding licenses in the county, chicken permits in the city. If you can have up to 6 hens, but you're supposed to have an urban poultry permit in the city limits of Missoula. No roosters, can't have roosters in the city. But a lot of people do like to have their urban chickens for their eggs. And then if we find somebody in violation of an ordinance, we try to work with them. We maybe give them warnings, see what we can do to help. And then if all it spells, yes, we will write citations. They are criminal misdemeanor citations. So as long as we have probable cause, the animal control officer can issue that citation. And then it's turned over to the hands of the courts, and then it's sorted out of our hands, and we'll find out later on if they pled guilty, if they pled not guilty, and if it went to court and what the outcome was. But we sort of have to wait for a report, those disposition reports that are sent to us. So as far as the assurance, we want to make sure that there's access to every to all citizens. We want to improve and constantly innovate what it is we do. So these are some of the things that we do in order to meet those core functions. So I'll kind of briefly, we do low cost vaccine clinics and low cost spay neuter clinics. Currently, we do not have a vet. There's actually a national vet shortage. So if you go get your Master's of Public Health and then want to go to vet school, we'll do that, because there's a lot of veterinarians that do shelter medicine that actually turn around and get their Master's in Public Health and after that. So I encourage you, we need more vets in the country. We're low. If we ever do get a vet back on staff, then we would be able to offer more of these low cost vaccine clinics and spay neuter clinics. Even though we don't, I often encourage people to utilize a program called the Street Dog Coalition in town. The Humane Society of Western Montana often offers clinics. I've seen online where like Petco has monthly clinics. So when we can't, we're still trying to educate the community and let them know who can go, where they can go to get these services if we're not able to provide them. And please, that's the main thing, is everybody should be spaying and neutering their pets, especially the cats. If you feed a cat, fix it. That's just kind of, you got to do it. You feed it, you fix it. So how many?
2 to 3.
Okay, I'm gonna hurry. I've only got like 2 more slides. So we're fortunate enough in this industry. It's come a long way over the years, but now there's a specialty in vet school called shelter medicine. And so there are programs. We're lucky to be kind of between 2 very popular ones called the one at UC Davis and the one at the University of Wisconsin. So these programs are great because they have outreach staff that will come to your shelter. They will do a evaluation of what you can do to improve, to help you with your policies, your procedures. And so they're a wealth of knowledge, and a lot of times they come out and they don't charge to help shelters so that they can improve on their practices for both, especially for the animals during their stay. There's also large other nonprofits that come out that help us improve. Maddie's Fund is one of the large ones. They give out millions of dollars to shelters. They spend millions of dollars doing research. So, and then they share their knowledge with all the other shelters so everybody can do better and save more lives. But there's other groups like Best Friends, the Bissell Pet Foundation, Petco, PetSmart, all of these groups give out grants. And as long as you're doing the right thing and you're following best practices, they want to see you succeed. So they're constantly providing education for us to do better and save more lives and reduce our euthanasia rates in shelters. So that's a huge, that's huge for all shelters in the country. And then finally, our guidelines for standards of care. When it comes to the animal control officers, we have an organization called NACA, which is the National Animal Control Association. So they set a lot of those guidelines for standards for animal control officers. And then in the shelter situation, the Association for Shelter Veterinarians put out guidelines for standards of care. So that is something that's really important to us, those guiding principles that we want to meet the physical and emotional needs of animals while at their shelter. We're getting ready to expand our building. Right now, our kennels are smaller than what those standard guidelines are. They're not double-sided housing to reduce stress. Cats can hear the dogs barking. There's just a lot of different things. And so we utilize these guidelines for standards of care, and we'll be utilizing them moving forward as we expand the building to improve not only the needs of the animals, but also the needs of the staff in our building as well moving forward. So it's the new guidelines were just released just a few months ago. The previous version had been 10 years prior. This is a really long industry to only have a set of guidelines, and there's not a lot, they're not mandatory, but the groups that give out money and want to help, then they say, we want you to be going by these guidelines. So that's what we try to do. So that's Tumbles. She's our office kitty. So does anybody have any questions?
I just typed into the chat. That was you. Just saying if anybody has any questions.
I have a question.
Okay.
I would assume you'd have to get this from like local veterinarians. Do you have any idea what our like vaccination for rabies, like compliances with?
I don't. We were saying at one point, we think about 30% of the animals in Missoula are licensed. So we know those have a current rabies shot. I have lived in some areas where the veterinarians actually had to send us records for everybody that was vaccinated. Not the case here. But I would say the majority of the calls that we go on when we check to see if someone's licensed is more times that they're unlicensed than they are licensed. So there are a lot of animals out there that are unlicensed in Missoula.
No,
What do you,
no questions online yet. Victor White just has a comment, says, I really admire the great work that you do.
oh, thank you. If you know anybody though, make sure you tell them their dog needs to be licensed. Clean up their dog poo. The annual spring thaw is in full force and we're getting calls about it from all winners. So I brought some poo bags, so grab them. If you notice anybody, you know, encourage people to have their dog on leash. We get a lot of calls for these and we can't be in all places at once. And nobody ever wants to violate the ordinance in front of us. So if I have an animal control officer out there, they're not going to violate the ordinance right in front of them, right? So. Yeah, I encourage anybody, like, come down to the shelter if you want to volunteer, if you want to, you can open your home up to foster. If you just want a tour where you can see what it is we do a day in the life. I don't think everybody quite understands all the multitasking and everything that goes on any given day at the facility. There's a lot that goes on. You never know what's going to be on the other end of the call when you pick up the phone.
You might have already said this, but what is your general capacity for cats and dogs?
So I would say it varies because sometimes you might have a nursing mom and babies, but we have 24 dog kennels in our main area. They really, if we had them double-sided the way we should, and that we will eventually, if we were to cut them down, we would only have 12. But right now, we have 24. In our cat room, we have about 30 cat cages that we can house cats, but what we see when we start, we've got 3 layers. What we see is when we start filling the room up that full, especially adding cats to the bottom, cats get sick from stress. And so just having that many cats in a cat room, they all start to sneeze and get respiratory infections. So we try to keep those numbers in check. They say it's ideal not to kind of maintain at that 80% capacity. So you have this few extra kennels and cages. But we notice when we start to fill, really 8 to 10 cats is about what you would want in a room. So when they're designing new shelters now, they're saying you should have more small, flexible spaces instead of big rooms where you have a lot of animals. And when you have dogs, you should put them in smaller compartments with fewer dogs because they just don't stress out. And it's true, when you have one dog that behaviorally doesn't do as well, that dog can just make all the other dogs in the kennel kind of go just as mad. They bark and they react, and you remove that one dog and the entire kennel, it's just much calmer and more relaxed. And it really is, we want to try to keep them as low stress as possible in a very stressful environment, because it does increase disease and upper respiratories and other medical problems.
Oh, someone has raised their hand. Would you like to open up your mic?
Hi, can you hear me?
Yes, we can.
Sweet. Holly, wonderful presentation. And as a infectious disease nurse for Missoula County, I just want to thank you and your team for extremely professional, thorough, friendly, timely work. I've lived in several communities that don't have animal control, and the follow-up on animal bites is, well, much more expensive, basically, and much more complicated and stressful. If you can't quarantine a dog, cat, ferret after a bite, people don't know what they've been exposed to. So you save the community a lot of money, you save the community a lot of stress, and your infectious disease nurses adore you. So thank you so much.
Well, thank you. I'll be sure to relay that to all the ACOs.
Have you had any opportunities to really engage with medical providers in Missoula to kind of get some of this education out?
Our animal control officers haven't. I know that I can't really speak to everything that the health department has done, but I know they did put together that video that I showed. And the goal was to send that out to all medical providers, because it was just around 5 minutes, watch it. So we would try to get more compliance on reporting the bites. We just don't get, a lot of times it's the victim. Occasionally we'll get veterinarians that will call us. They always call us when they get bit. Sometimes we'll have the dog owner that bit somebody else that will call and report on their own dog, which, and oftentimes we get a lot of calls from where the public's dog was bitten by another animal, and they think that their dog, the victim, has to be quarantined. They're like, oh no, my dog's gonna have to be quarantined, when it's actually the suspect that you do the quarantining. But they always think, oh, my dog's got to be quarantined, and we have to explain to them, no, your dog's fine, we don't have to quarantine your dog. We try to encourage people, keep your dog on leash, because everybody doesn't have a friendly dog, and it's not fair to those that have reactive dogs for that friendly dog to run up to that dog's face. They have just as much, they want to have their dog on leash and walk them and not have to worry about that dog off leash running up to them. And if that dog off leash runs up to them and gets hurt, they should have been on leash, but I mean, I take foster dogs out all the time. I always have a foster dog, and people run up to me all the time, off leash on trail. They don't know who I am, but they're running up to the dog I'm walking. I'm with their dog off leash. And I am that person that will ask somebody to pick up the poo and put their dog on leash. Doesn't always work, but I always encourage them to do the right thing.
Just about out of time, but there is a question. If others would like to get a copy of that student video, what's the best way for them to get a copy of that?
I can send it out, email it. I've got a copy of it.
I copied the email, Patrick.
Oh, you got, okay,
Yeah, I'll make sure I'll use it.
excellent. Yeah, very good.
And if anybody wants a copy of the exposure trees, the assessment trees, they're online, but I'm more than happy to forward those as well. You can kind of get into the nuts and bolts of what we have to like think about when something is bitten and what did the biting and the vaccine status.
Very good. Thank you.
All right.
Thank you.